Greetings once again. It's a pleasure to be back. So today I'm going to talk about pharmacists in mental health advocacy and management, global health pharmacy concept. So one of the key things that I wanted to highlight is the fact that there's a growing interest in global health, which is, in terms of the definition, is about looking at population health across the world in a worldwide context in that some way. And it would be looking at the study, research, and actually practice that is focused on improving health and improving access to quality healthcare, equitable access to healthcare services, which is the confine and actually the principles behind global health. So when you talk about global health pharmacy, the principle is looking at how do we have actually improved health outcomes and improved access to quality healthcare services by leveraging the pharmacy pipeline, which is including pharmaceutical services and pharmacy products, and looking at the strategic and positioning of pharmacy and pharmacists in terms of delivery of these healthcare services. So this particular session is inspired by one. This is a World Mental Health Awareness Month, that is May, and therefore we need to look at what role can we play in terms of improving access to mental health services and improving mental well-being of our people in our communities. That is the first thing. And the other thing, I have a colleague who reached out to me asking, what strategic positions exist for pharmacists in global health? And then I looked at that particular question. The key thing for me would be, what are the challenges we have in global health? How do we position ourselves to address these challenges? And as we are addressing them, we make value and contribute positively into the profession of pharmacy. And beyond the profession of pharmacy is to improve access to healthcare services and improve outcomes for patients so that we have a healthy populace. So that would be the principle behind population health and global health, that is. And in that global health, we are looking at this case now, mental health specifically. So what's mental health? Mental health would be defined as the state of mental wellness when an individual is able to realize their potential, contribute positively to the community, cope with stresses of life, and actually find meaning and purpose in whatever they're doing in their day-to-day activities. And therefore, it's beyond just being unwell, but being in the best functioning capability, being able to contribute to your community and be of value to the society and to the individual where you are. And therefore, when we look at that in that perspective, then the key bit for us as pharmacists in mental health, we need to ask ourselves, what are the factors that would make someone not thrive? What are the factors that would make someone not to be at their best mental health status? And then how do we contribute to addressing these? So our role in terms of addressing these would be diverse and varied, and that would be based on where we are practicing, how we are practicing, and the kind of people that we are serving in that particular domain. And therefore, they need to ask from the starting point, what is the place of the pharmacist in mental health advocacy and management, looking at the spectrum of mental health care services, starting from promotion, mental health promotion, mental health prevention of the mental illness and disorders, the curative aspect, rehabilitative, palliative support care for people with mental disorders and mental distress. So there's so much that we can do. When we talk about pharmacy-based mental health services, at this particular level for me, the focus was, what are the current standing programs that we've been running as pharmacists in terms of mental health service delivery? One of the key things we acknowledge is that mental health services have been institutionalized for a long period of time. And with this institutionalization of mental health services, where we have to go to a hospital to receive the mental health services, then most of the care by pharmacies have been in terms of dispensing medications. For example, in the Kenyan context, we have the premier mental health hospital, that is Malaria Teaching and Referral Hospital in Nairobi, Kenya. So that has been the main institution. What do pharmacists do in these places? We can have access to the medication where we dispense medicines as per the prescriptions, review these prescriptions, and ensure we optimize therapy for these patients. And that is one of the key roles. But beyond the medicines, we can have other roles. And that is what I'm asking myself, what are the now emerging areas? Because for the mental health institutions, we have few people. And when somebody presents to these few institutions, the critical factor would be they are in a very severe case, and therefore we need specialized care. But beyond specialized care, which means we are not addressing challenges when they are emanating, they're just getting realized, getting a knowledge, people are getting to know about them, getting awareness. So there's more that we can do. And that is now shaping for me the next conversation where I'm looking at what are the new frontiers in mental health care service delivery and how pharmacies can contribute to this future in terms of delivering mental health services. And the other reason that we need to look at this from a kind of a vantage point and also at a critical point of contact is the fact that burden of mental illnesses and mental disorders have been on the rise. And this actually has been exacerbated by the ongoing pandemic that we've been facing, where we had so much disruption in our lives based on work, personal family lives, loss of lives, and everything that has been happening around us. And this is putting so much pressure, so much stresses, unemployment issues, economic challenges, and there's so much that is happening. Now in a Kenyan context, we could talk about the political political instability that might be, or would call it not political instability, but rather the political tension. There's so much focus on the political landscape as people are working towards the elections. And with this electioneering year, so many people are skeptical about whether they're going to start their business, run them effectively, employ new people or not employ. So these dynamics are not so good for everyone. And therefore, we need that kind of psychosocial support systems, engagement with communities, mobilization, advocacy frontiers, and actually providing the services that people need with regard, depending on the particular level of need that they have. So first thing I would feel as the role of pharmacists in this space would be community engagement, social mobilization, and advocacy. As much as we work within the communities, we know the challenges that our communities experience. So the first question for us would be, well, how do we engage them? How do we part of their network? We need to understand the dynamics of their lives, mobilize them to find ways of addressing these. What are the coping mechanisms? For example, we can have, let's say, normally on weekends you have in the community where you come from, we have these field activities where we go to school, soccer tournaments, and such kind of activities. It would be physical exercise that is moving us from being within the households where we stay and getting a break from thinking, actually getting us out of our minds. Because when we're in our minds, we are just thinking about the negatives and maybe there. And the most challenging aspect is that all our challenges come to fore when we are just by ourselves isolated. So we're creating a sense of community and a sense of engaging with the people in there we work. Then as we do this, we find ways of addressing some of the contributing factors. For example, you'd say poor governance. Then in the poor governance, when we're engaging and talking to more people, we can advocate for better governance, even when we're going into the election, championing for people who are going into leadership positions, who will actually look out for our mental well-being, look out to the socioeconomic drivers of our mental wellness, so that at least we are assured that the next regime, the next government will be able to address issues on mental health. That is an area that you can play a role as pharmacists. Then the next thing is psychosocial counseling and group therapy. The people would be coming to our pharmacies or areas of practice, and they need additional support in terms of psychosocial counseling and group therapy support and all that. So these people who are facing mental distress and mental challenges, we need to be in a position to provide the counseling. And that is where now the key bit for us is, do we build capability to be able to offer counseling services? And once we are able to do it, then we charter it as a particular service that we're offering, then we're able to deliver on that. Some of the times when people come to our pharmacies or our areas of practice, they might need advanced services. Let's say, for example, somebody coming, and from your clinical diagnosis and just assessment, you realize that this person might be having actually advanced schizophrenia, advanced depression that would need hospitalized care. Then you need to be in a position to offer referral services. The question is, as a pharmacist, do you have networks to these kind of referral institutions where you can refer them? That is another key bit that we need to integrate in our service portfolio and see how we can support people when they come to us, they're not able to get the services they need from us. We need to be able to refer them and make sure they get the help they need. That would be a good thing as well. Then from being medicines experts, there's the medication reconciliation and medication therapy management. People use medicines, there will be several of them, and we need to be able to actually reconcile and see which combination of medicines are good for them, and which ones would be actually increasing the risk of some of the mental disorders. For example, somebody using antihypertensive medicines or so cardiovascular medications, they'll have a higher risk of increased heart rate in terms of palpitations, or probably that. And this would also be characteristic of anxiety disorders. So if such a person is having such kind of a symptoms, then we need to ask ourselves, how do we tone down that kind of an experience in them? Because it would be discomfort. And if it's discomfort, then they're not going to take either of their medication that might be relevant. So what is our role in that kind of a care continuum? So we need to be able to offer. Then medication therapy management, when we give patients medicines, we need to ensure that they're achieving the best optimal outcome that we hope for, and we are guiding them in their care journey. So that is now monitoring the treatment, and we ensure it's optimal for them. Then the other thing, the next phase would be research of new therapies and alternative treatment options that are available. And research is a key bit because we know there's never advancement in practice, advancement in care in the healthcare space generally without research. And we need to develop new therapies, new treatment options that are available for the patients to derive maximum value and get relief for their conditions. And that is why we see there's so much work that is going around management of dementia, new therapy options are coming up. But what is our role as pharmacists? Probably we can try new interventions, we can engage with the research community and the pharmaceutical community to share some of the perspectives and insights that we think can help in terms of addressing these challenges, and especially even from experiences that we can capture from our local communities on what other people are doing and using to manage their mental health conditions. Then also alternative treatment options where we can talk about the group therapies, you can optimize them based on what people are dealing with, and all local experiences so that you have alternative options that can serve the communities where we work. The next thing is implementation and operational research on how approaches to mental health care service delivery. So when we talk about these new approaches to mental health service delivery, we know that most of these aspects that have been highlighted in this particular presentation are not the core of what we do as pharmacists currently. But if we can actually implement them in bits in terms of piloting some advances, some new models of practice, we can actually end up with better systems. And the main thing that we have to acknowledge is that there's this growing focus on how do we optimize global health service delivery, because systems have been more of the public or institutionalization, but we're realizing health is not obtained from hospitals, but rather people need to be healthy in their communities. So can we leverage on our positioning in the pharmacy space and actually reach out and solve problems? And as we develop new health systems, new models of practice, and these will now be integrated and institutionalized through policies that we can create once we have best practices. So the key thing is we need to be able to do implementation science, operational research, develop new approaches to mental health care service delivery, and deliver on these as we continue in our practice areas. The other bit is in terms of education and training. As much as we're talking about what needs to happen, how we can shape the future of pharmacy practice with a focus on mental health, it's not going to happen unless we are competent and skilled enough to deliver these services. And therefore, we need to be actually involved in education and training to ensure the future generation of pharmacists coming into practice are people who, one, are informed about mental health and the mental health challenges that we're having in our society, are equipped with the skills to manage mental health conditions from assessment, diagnosis in some cases, and even the intervention in terms of offering treatment and psychosocial counseling. And where they're not able to offer that service, then they'll be able to refer. And therefore, they need the project and programs management skills and competencies. And that is one thing that I believe we need to integrate in our education and training. In the last bit, as much as all this we're doing is going to be good, it's only good if it is institutionalized and there's kind of a level of sustainability. And that sustainability can only be put in place if we have policies that are grounding them and making them be sustainable in the long term, because there's a legal framework for it. And that is where now, as pharmacists, when we try all that we're doing, when we engage in the different forums and platforms, we need to share these perspectives. Once we share them, we make them stand out because we know what needs to be done, how it needs to be done. And then we'll be able to shape the future practice and ensure that as pharmacists, we're doing something in mental health. And this is my challenge for you as the viewer, as the person watching this particular clip today. It's Mental Health Awareness Month. What are you doing to improve your mental health as an individual, as a pharmacist? What are you doing to improve your mental health? Are you taking the breaks? Are you doing yoga or even doing exercise, going for exercises? Do you unplug from every other social media platform just to be with yourself? Do you engage with your loved ones? So that is the first thing that I'm giving you a challenge. Take care of your mental health first. There's no way you're going to manage other people's mental wellness unless you do yours. So that is the first challenge. The second challenge is in your area of practice, whether in the hospital, community pharmacy, or even in an organizational level, corporate world, you work with people. The people you work with, can you engage with them and talk to them about mental health? Can you encourage them to be open about their mental wellness and actually take action to improve that mental wellness? That would be a good thing. Read about what you can do and please do something on that. Another case, now when you're working in the hospital setup, in the clinical setting, the patients that are coming to you, they need more than just the medicine that you're dispensing. Can you engage them, be personal, be empathetic enough to realize that this is a human being coming to me and I need to offer them a service. I need to understand where they're coming from. I need to be there for them across their journey. And if you're able to do that as a pharmacist, we'll be the people who are shaping the future of mental health service delivery. And I believe with that, we'll shape the future of practice and we'll be better professionals. For Mental Health Awareness Month, do something for mental health. That is my challenge for you. If you enjoy the channel, the video, the content that I'm sharing, please subscribe to the channel, like, engage with us, share with your peers as well, and let's promote pharmacy practice and promote healthcare service delivery. Looking forward to engaging with you in the next episode next Sunday. Thank you so much. Have a good one.